Ready? Go.
All right, so number 1, hold your finger up to your nose and smell it. It's the olfactory nerve involved with smell. It's a sensory nerve. Number 2 is optic. Optic is for vision and visual acuity, so a sensory. Number 3 is ocular motor. Ocular motor, pretend you're focusing in on something because it's involved with pupillary constriction, and you could assess this using Perla, and also it's involved with the extraocular eye movements. This you could assess with 4, Trochlear, the inward and down motion of your eyes, and also the Abducens. Abducens, like think abduct, like away, your lateral rectus muscle, and 4 is your superior oblique muscle. So 3, 4, and 6 is, you could do all that with the 6 cardinal gate. I always go like that, but it's actually 1, 2, 3, 4, 5, 6, and there's different ways to do this, but you're looking at the patient's, whether they can follow your movement smoothly, and it's also assessing that, looking in and down, looking to the side laterally, and also the rest of it's going to be ocular motor. So ocular motor is going to do the rest of those extraocular eye movements. So that's 3, 6, and 3, 4, and 6. Let's go back to 5. 5 is trigeminal. I do a triangle, and it's the 3 branches pointing towards your forehead. Ophthalmic branch is your forehead, eyes, and part of your nose. The maxillary branch is your cheek, a little bit of your nose, and also the top lip. The mandibular branch is your chin, your jaw, and your bottom lip. Maxillary, so trigeminal, that's sensory. So if your patient can feel something on their face, and also it's motor for the mastication. So it innervates the temporalis muscles, the masseter muscles, and masseter is the grinding, temporalis is the up and down. That's 5, trigeminal. And then we talked about 6. 7 is facial. It's the motor portion of your face. So ask your patient to smile and raise your eyebrows. For your eyebrows, puff out your cheeks. And is everything symmetrical? If not, then maybe that cranial nerve 7, there's some damage. And also the hand, I use it as a tissue, and I'm going to pretend to wipe my tears and my nasal, and also my saliva, because it's involved with the lacrimal glands, the nasal mucosa, and also the submandibular and the sublingual glands for salivation. And I'm going to pretend that the tears, I could taste it. It dropped to my tongue, and I could taste it because the sensory portion of the facial nerve is for the anterior 2/3 of your tongue for taste. So again, facial movements, and also it's involved with lacrimal glands, nasal mucosa, and the glands involved with saliva, and then the anterior 2/3 of your tongue for taste. 7. 8, more straightforward, for hearing, sensory, hearing and balance, vestibulocochlear nerve. Number 9 is glossopharyngeal. Glossopharyngeal for your swallowing, for gag reflex, and it's also the posterior 1/3 of your tongue for taste. So that's the sensory portion. Sensory and motor is number 9, glossopharyngeal. And number 9 also works with 10, the vagus nerve, for assessing swallowing and gag reflex. The vagus nerve, when you ask your patient to say ah, and you could look at their uvula if it's midline, the palate if it's rising. Number 10, it's involved with your respirations too, your lungs. your heart, and also your digestive system. And number 11, spinal accessory nerve. It's a motor nerve. When you're asking your patient to shrug, you're assessing the strength of the shrug and also the turning of their head. Is it strong? Because it innervates the sternocleidomastoid muscles and also the trapezius muscles in the back. So that's 11, the spinal accessory nerve. And 12, last but not least, 12 is the hypoglossal, so motor for your tongue. And then in the ATI video it said you could say the light, tight, dynamite, and there you have it. Some of the mnemonics that help me remember is the O, to touch and feel very good velvet, awe heaven, to remember the order, and to remember whether it's a sensory, motor, or both. I remember the some say marry money, but my brother says big brains matter more. So if you remember those, then you could also help you remember the order.
Awesome.
Thank you.
I'm like